Hi, my name is Jackson Jones, and for my psychology and film assignment, I chose to do a case report of Jessica Jones. Jessica Jones is a superhero private investigator that has super strength and durability. She's in the show Jessica Jones on Disney Plus. She lives in Brooklyn, New York, in the Marvel Universe, and is in the area of other superheroes like Daredevil, Luke Cage, and Iron Fist. In Brooklyn, there are always new conflicts and bad people that Jessica Jones has to fight and stop. Throughout the first season, she is fighting to stop Kilgrave, a villain that has mind control powers and has controlled Jessica before and has caused her trauma. Jessica Jones has post-traumatic stress disorder, also known as PTSD, which is a mental health condition that is caused by an extremely traumatic event that has happened in the past. Symptoms that can come from PTSD include anxiety, nightmares, flashbacks, and uncontrollable thoughts about that traumatic event. She developed this disorder after a traumatic event in which she was mind controlled by a villain named Kilgrave and was forced to hurt people. The film takes place around the era that we are in right now, so she would be able to go to a therapist and get a solid diagnosis. The disorder would not be blamed on supernatural causes or anything like that. I believe that if she went to a therapist, she would get diagnosed with PTSD. Considering culture broadly, though, I do think this disorder would be diagnosed in almost all cultures, just because there's so much awareness about it and how it works. But I do think that since Jessica Jones is a woman, that it could lead to her not being able to get the proper care in some other cultures. One article shows that discrimination can occur to women when it comes to PTSD diagnosis, because in most cultures, girls and women are subject to discrimination in form of limitations on their access to crucial socioeconomic resources. Jessica Jones shows a lot of symptoms of PTSD in the show. The two that I thought stood out the most were nightmares and flashbacks and triggers. She also exhibits substance use as a coping mechanism. In season 1, episode 5, she has a flashback of when she first meets Kilgrave and is put under his mind control. This is triggered by her seeing her friend that was there when it happened. In season 1, episode 2, she sees the man whose wife she was mind controlled into murdering by Kilgrave, and it sends her into a flashback of the traumatic event where she was forced to murder the innocent woman. Also, throughout the entire first season of the show, she is constantly drinking to numb her pain and anguish that she is going through because of PTSD. One of the symptoms that she does not show in the series is avoidance, which is when you avoid reminders of the traumatic event. Throughout the TV series, she interacts a lot with Luke Cage, who is the man whose wife she murdered, and she also goes after Kilgrave to try and stop him, instead of avoiding him and running away. She clearly does not show avoidance in the series. The DSM for PTSD requires that the person was exposed to threatened death, actual or threatened serious injury, or actual or threatened sexual violence, and that the trauma is relived by either unwanted memories, nightmares, flashbacks, emotional distress, or physical reactivity after exposure to traumatic reminders. My treatment plan would include Jessica going to see a therapist first, where they would do intake and begin helping her. I would then have the therapist start doing cognitive behavioral therapy with her and cognitive processing therapy. Cognitive behavioral therapy helps patients focus on the relationships among thoughts, feelings, and behaviors, and changing patterns of behaviors, thoughts, and feelings that lead to difficulties in functioning. Cognitive processing therapy is similar, but it specifically helps patients modify their beliefs about themselves related to the trauma. I think these therapies would help Jessica learn about her PTSD and how to properly deal with it. She has a lot of negative thoughts about herself related to PTSD and improperly copes with these thoughts with alcohol. I think these therapies would help her cope properly and help her change her own thoughts about the trauma. There are no ethical concerns with this treatment, and it is widely accepted as a great way to treat PTSD. I believe there would be no barrier stopping Jessica from receiving this help. She lives in our culture where we know what PTSD is and how to treat it. I believe she would be able to see a therapist and begin getting help with her disorder. According to this article, CBT is the most widely used psychotherapy for PTSD, and there is considerable empirical support for its effectiveness. Broader perspective. The portrayal of PTSD in Jessica Jones is very accurate, which is the reason I immediately thought of this show for my project. I think it is accurate because it shows how flashbacks can be triggered by little things, and also shows the emotions and behaviors that come after a traumatic event happens to you. It shows how some people cope with PTSD by using alcohol and self-medicating, and it also shows the guilt that a person can feel from a traumatic event. More broadly, the seeing this disorder in a film can help us visualize what a person sees and how they feel. It brings awareness of mental disorders, which can help the public empathize with those who have them. I do not think that culture would have an impact on our perspective of PTSD in Jessica Jones. These are my references, and this is my AI documentation form. Thank you.